Welcome back. This is the AM show here on Joy News. And we're having a conversation now about breastfeeding. If you're alive and you're watching, chances are you were breastfed as a baby. Fondest memories from both mothers and children, because it's such a season of bonding, and those first few days are so special and so important that we give our babies the best start in life. And it's always been very interesting that the body can produce what our children need when we have them. Unfortunately, new data is revealing that less than 50% of newborn babies are being breastfed, which is very, very worrying. To have this conversation with us this morning, I'm joined by Constance Odonko. She's a senior midwife at Colostrum, and Rosemary Asante, who doesn't know her husband's hometown, but she's a nurse, also at Colostrum, and that's just a joke that we're sharing here. But we're having a conversation this morning on breastfeeding and why mothers are perhaps choosing not to breastfeed as much. So jumping straight right in, Constance, because this is the question that I've been wondering, is why? Why are the numbers going down?
Thank you, and good morning to your viewers. So breastfeeding is very essential in the life of the newborn. But the challenge is that health personnel or health workers are doing their best to be able to advocate and then give them the importance of breastfeeding. But unfortunately, we need each and every individual on board, all levels. So even our team is protecting breastfeeding, a shared responsibility. So we all need to be involved. Stakeholders, the government, the media, and even the community, which will help us go a long way.
Okay, so are you saying that we're not breastfeeding as much because we're losing sight of the importance of breastfeeding?
Yes, the importance and then the support. The importance as well as the support. A mother may need to give the baby the breast milk, but sometimes she needs somebody to assist her, a bit of household chores here and there, and also the encouragement. We help her, the encouragement to know that breastfeeding is essential for the baby, and as well with good communication skills as a health personnel. For instance, you being able to ask the woman open-ended questions and then welcoming the person and also appreciating the fact that she's even breastfeeding in the first place. If not, it will even discourage her. So it cuts across the way we communicate as well, and then helping the support system so that they would also know the essential of breastfeeding. A father who comes to the antenatal unit with the wife knows that the midwife spoke about breastfeeding. So he will also encourage the wife to continually breastfeed the baby. Okay.
I'm finding it's a little bit difficult to relate to the concept of needing to be encouraged to breastfeed. I think because for me, perhaps the importance or the value of breastfeeding is something that has always been. It's like it's our mothers breastfed us. You know, we saw our grandmothers breastfed. You know, so what in terms of education, what are the things that are actually hindering this thing that is so natural? Because it's such a natural, you have a baby, you know, your breasts swell up, you know, it's almost instinctive, isn't it, to put the baby to the breast. So you're almost going against nature to say, actually, no, I'm going to deal with, you know, swollen, hardened breasts and not breastfeed. So what is causing that?
Okay, so what's causing that is some mothers prefer not to breastfeed their babies because they don't want their breast to fall. They want to keep the breast for their husbands.
I see. Husband of a baby.
Yeah. So that's why they don't breastfeed. Aside that too, because of formula, you and I will agree that of late, anywhere you go, there's formula. Yes. So because of that, mothers prefer the formula as compared to breastfeeding. Aside that too, working mothers, because of the maternity leave issues, they are not able to breastfeed their babies. They will leave their babies. They don't know that they can store the breast milk, so they tend to go in for formula. These are some of the issues. Some mothers don't know the importance of breastfeeding.
Okay, so maybe let's start from there, because these are legitimate issues. So maybe let's start from the importance of breastfeeding. So let's start with to the children or to the babies. What's the value? What's the importance of breastfeeding?
Okay, so breastfeeding to the baby. You see, breast milk, it's the nutritional, is the right nutrition for the baby. Complete nutrition for the baby. So it helps the baby to develop well. Cognitive development, aside that, it's easily digestible because that is the right food for the baby. Yeah. You get it. And aside that, it helps to prevent infection. And preventing infection, it helps to prevent long-term non-communicable infections, non-communicable diseases like obesity, diabetes, because studies have shown that babies who take in formula have high risk of having diabetes as compared to babies who are breastfed.
Okay. I mean, and obviously you can't estimate the importance of colostrum, the first few days. I mean, so I would say that, at least even if you're not going to do it long term, for whatever reason, those first few days are absolutely essential to give your baby a kickstart, because they're not going to get immunized for a while. And it does give some sort of immunity, doesn't it?
Yes, so the colostrum, most mothers don't know the importance of it. Colostrum. Yes, they don't know the importance of the colostrum. So now we are having education for our staffs and our mothers, because some of them, they just dispose it off.
Oh, wow.
Yes, they tell us they don't know what's that.
Because it doesn't look like milk.
Yes, it doesn't look like milk.
Very light,
yes, so we are educating our mothers on that they should give it to their babies, because at that instance, it's going to help protect the baby. It's a form of vaccine.
Yeah, it is.
Early vaccine for the baby.
Color.
Yes, yes.
So it contains all
okay, and then, so also, I mean, in the first few days, there's also the benefits of breastfeeding to the mother.
Yes.
Do you want to touch on a few of those?
Yes, so breastfeeding to the mother, we are advocating for skin to skin, right at birth. When the baby is delivered, the baby is put on the mother's abdomen, stomach, the head is covered and the blanket is covered, and so that the baby would bond with the mother, as well as initiate breastfeeding right away. What happens is that the more the baby breastfeeds, then it also helps with the releasing of the oxytocin, which helps the uterus to contract and help prevent what we call postpartum hemorrhage.
It's painful, but
yes, postpartum hemorrhage. So we're advocating for skin to skin, and then currently we are even doing right at the theater table. Skin to skin right at the theater table. When the baby is delivered, we put the baby on the mother's abdomen continually till the procedure is done and it's working.
Okay. I want to add up to it that aside that, it serves as a form of family planning for the mother.
Yes,
that is, if you do 6 months exclusive, 6 months exclusive, no water, no food, no fluid, only breast milk. In that way, it's a form of family planning.
Contraception, because you won't get pregnant.
Yes, and mothers who breastfeed have low risk of having ovarian cancer and breast cancer.
Okay, that's good to hear. I breastfed for 2 years, my daughter, so definitely good to hear. So let's move on. So these are the benefits. Just quickly, it's good for your child. It'll give the child the immunity that it needs. You will bond with your baby. Your uterus will be contracting, and so it will come back to its normal size, and most likely you won't bleed, so there'll be no hemorrhage. And of course, also you're protecting your baby absolutely by giving them nature's best, as we call it. But let's talk about some of the reasons why mothers are not breastfeeding. A big one would be going back to work. So perhaps we can have a really short conversation on storing breast milk.
Okay, so let's look at our theme for this year. Protect breastfeeding, a shared responsibility. Stakeholders should get involved. They should look at our maternity leave for us.
Number one.
Yes, number one. It's very important. Yes. 2, we are educating our working mothers that they can store their breast milk. Yes, in Ghana here, because of light out issues, this doom saw, you can store it in the freezer for 6 months. So this is what we tell mothers. You keep it in the freezer, you label it with a date.
I think you have to start from the pumping.
Okay.
So, yes. Because I'm sure someone is like, how am I going to sit down and, squeeze, my boobs? So they're machines. Okay. They're pumps.
So
I think you can get some from Makola.
Yes.
Aside from, like, I even use the manual.
Okay, which is
on hand press.
Yes.
It works perfectly.
Yes, it works.
Yeah. Okay.
Okay. So aside using the manual, so that anyone who cannot afford the breast pump, yes, you can go manual. Then we have breast pump.
This is where, for those of you who were asking how fathers can get involved in breastfeeding, you can help your wife by pumping.
Yes.
When her hands are tied, you can actually just, do the pumping action to squeeze out the breast milk. So Israel, there you go. That's how you support your wife on your next baby. And for the fathers out there, so yeah, okay, go ahead.
Yes, then you can use the breast pump. So the breast pump, we have the manual and then we have the electric. Yes. So which anyone you want to go for, you go for it. So when you pump the breast milk, you can buy the small containers you squeeze the breast, keep the breast milk in. Then you make sure you write the dates, the time on it. So that when you store it in your freezer, when you are going to work, you teach whoever is going to use the breast milk how to breastfeed the baby, because definitely that person will have to use cup and spoon. Yes, we are encouraging cup and spoon as well.
Okay.
So
as opposed to the bottle?
Yes.
Okay, what's the reason for that?
Okay.
The reason is that the baby used to the with the bottle, there'll be nipple confusion as well. Sometimes the baby will not be able to suck the breast, and then we'll be concentrating on the nipple. So we don't want
the bottle.
The bottle. So there's nipple confusion.
I think also the nipple needs a bit more suction. So once you switch to the bottle, like the children find it's easier for them, is it?
Yes, because that one is softer and all that.
Yeah,
so.
okay. Okay, but obviously you want to keep them at the nipple because of the other benefits.
Yes, and aside that, so infection. Some mothers don't take very good care of their bottles. So we see baby coming in with diarrhea and other issues. Yes, that is why we are encouraging cup and spoon. So you teach whoever is going to give the baby the breast milk to use cup and spoon. The person should wash their hands. Go in for the breast milk. You start first.
So first in, first out.
Yes.
Okay.
So the person takes that breast milk, keep it in a warm water.
I was going to ask about that.
Yes,
okay.
so that it becomes...
So not hot boiling water.
Not hot boiling water.
Because otherwise you basically fry all the nutrients.
Yes, yes.
And not the microwave.
No, not the microwave.
Okay.
Not the microwave.
Okay, so warm water.
Warm water.
So you need to take it out maybe an hour before, a couple of hours before, if it's frozen.
Yes.
Okay.
Then you put it down for some time. When you're about to breastfeed the baby, you make your warm water, then you put it's in a cup. So it will be in it. When you test the temperature, if you are okay, it shouldn't be too hot.
Yeah.
Then you breastfeed the baby.
I think we learned that when you pour the breast milk on your skin, you shouldn't feel anything. Which means that it's neither hot nor cold. It's kind of just room temperature.
Yes.
So then that's fine.
Yes.
So this cup and spoon method, which I'm hearing about it for the first time. What do you use? What do you use? Like a plastic spoon or like a?
Yes.
Use a plastic. You can use the plastic. We prefer the plastic spoon.
So the baby spoon.
The baby spoon.
Okay.
With a small a small cup.
Okay.
Yes.
And then you kind of just.
Yes, you hold the baby with your cup and spoon. You cover with a bib or any handkerchief you have. You take it, then you put it in baby's mouth.
Okay.
Yes, as a form of bonding. As you are putting it, you say good things to your child. See, baby Rosemary. Then you breastfeed.
Okay. Okay. So this is a third person doing it. So maybe daddy.
Yes, that's how the husbands come in.
Yes. Yeah.
Yes.
Yeah. Okay. So we're really discouraging the use of the bottle.
Yes.
Okay, and also discouraging the use of formula.
As well as pacifiers.
Why?
The reason is that, you know, when the baby uses the pacifiers, unfortunately, the baby will not be able to suckle at the breast very well. And what happens is that the mother might think that, okay, baby is fine, baby is okay, baby is full. Unfortunately, the baby will just take a bit of the formula, put the baby down, and the baby will be crying. And then the pacifiers also room for infection.
Okay.
Maybe a nanny is taking care of your baby, you're going to work.
They're not cleaning it.
You won't be there to watch. So realize that maybe the pacifier will just fall on the floor. She'll pick it up, check nobody is watching, put it back into the baby's mouth, then she'll go and rest or do something. Unfortunately, there'll be infection all the time. So we are discouraging pacifiers. We are discouraging.
Another thing that I wanted to clarify with you guys, you know, when you're breastfeeding, you are told not to switch from one breast to another in one session, right? Is that still the way to go? So you keep the baby at one breast for one feeding. I can't remember exactly what it was, but finally there are different layers of milk that come out, and you kind of want the child to get the whole.
Yes. So when you are breastfeeding, you want the baby to get the full meal. We have what we call the fore milk and then the hind milk.
That's
the fore milk contains fats as well as protein and lactose. Likewise, the hind milk. But the fats with the fore milk, the energy is less compared to the hind milk.
Okay.
So the baby should get a complete meal. That means the baby has taken both fore milk and the hind milk. With that one, baby will be well satisfied.
Okay.
But if the baby takes just the fore milk, unfortunately, within a few minutes, baby will be hungry again.
Okay, so what you shouldn't do when you're breastfeeding is, let's say you're breastfeeding for 20 minutes, do 10 minutes on one breast and then do 10 minutes on another. You don't want to do that. You want to keep them on one boob per feeding session so that they can get the fore milk, get the hind. It's like, the starter, the main meal, the dessert. Definitely. And I think when you do that, then they're fuller for longer.
Yes.
And then, okay.
I think I want to add up to it that we want our mothers to know that there is nothing like this breast is water and this breast is full. All the breasts, they are all equal. What is here is the same as what is there.
Yeah.
So you see, we have some clients who tell us that, oh, my mother says this one is water. So she only gives this one when she feels baby is thirsty.
It's thirsty. Yeah, okay, get that. So like Rosemary has said, also a gentle reminder to those listening as well that with breastfeeding, you don't need to give your baby water.
No. So
that is why we define exclusive breastfeeding as exclusive breastfeeding.
Please, we don't understand exclusive breastfeeding. Okay. Water is power.
Okay. Exclusive breastfeeding is giving your baby only breast milk without any water, food or fluid. No, you don't give baby Coke, gripe water when you are breast. No. It's only
no gripe water.
Milk.
No gripe water.
Yes.
No gripe.
Okay, that's a big thing as well because Ghanaians, we like gripe water.
Yes, we like it.
No, I'm giving the baby gripe water. So exclusive breastfeeding, and it's recommended for the first 6 months.
For the first 6 months, and after 6 months, when we introduce complementary feeding, that is our family food, our Tom Brown, our porridge. You should still continue till baby is 2 years and beyond.
Within reason.
Yes. So baby is supposed to take the breast milk from 6 months. After 6 months, you continue to 2 years. And if baby wants to go to 3 years,
so you say 2 years and beyond.
And beyond.
Yes.
Yes. So our fathers, 2 years and beyond.
Wow, that's a long time.
Yes, it's doable.
I did it for 2 years, so definitely doable. But also, let's be honest, it's difficult on moms, if you have to do that. Especially with nighttime feeds. And also there's the comfort that children find in being so close to mom. So sometimes it goes beyond just the sucking for the milk to just the, being close to mom. So I think it's important that our mothers are aware that it does get a bit tedious and a bit difficult, but it's definitely worth it, isn't it?
Yes, it is.
Okay. So so let me open the phone lines and then we'll come to some demonstrations. And no, we're not going to breastfeed live on TV. If that's what you're looking forward to. But the phone lines are opened. It's 0302 211 691 or 0302 211 692. So call us if you have any questions. We have our midwives in the studio, very, very well informed. So they'll tell you, they can deal with your issues for you if you're having any problems. Especially one major problem. Okay, Samuel, 1 second. I'm coming to Samuel in a second, but latching is a problem, isn't it?
Yes, it is. It is a big problem. Okay, so this year's breastfeeding week in Kolibu, we are launching the fastest to launch competition. Yes, because we realized that, you see, Kolibu is a big hospital, and most of our cases are cesarean section.
Okay.
So the cesarean mothers, they always complain. I had CS because of that. My breast milk is not flowing well. Yes. So we've introduced the fastest to latch. Yes. We are going to do the skin to skin.
Okay.
Because when you do the skin to skin, baby is able to start breastfeeding within 1 hour.
Okay.
Yes, so we've introduced this policy. So when you come to our facility, feel comfortable to ask of skin to skin.
So get some support when it comes to latching. Yes. And when we say latching, obviously we're talking about the right technique that the child needs to be able to suck the breast milk. It's not the usual sucking. It's a whole mechanism which makes the milk flow. Well, interestingly, we have 2 callers on the line, 2 men. Not too sure what they're going to ask. Let's start with Samuel. Samuel is calling us from Takwa. Samuel, good morning.
Good morning.
Hi, Samuel. What would you like to know?
Actually, I just joined the conversation, but I understand everything that you have explained. But my question has to do with my child was on 6 months exclusive breastfeeding. And just like you said, a complementary, when he has gone beyond the 6 months breastfeeding. There is this complementary breastfeeding, which you combine breastfeeding with the home food and this kind of things. But my child is the type, anything you try giving him, he doesn't eat at all. It is only the breast that is being sucking. He is now 1 year old. And it is quite, boring.
Okay, so you'd like to know what kind of strategies to use to be able to get
Exactly. It is
Okay.
that I can do too.
Okay. Okay, sure. So let me just take all the questions and then we can come to it. So Esther is calling us from Cape Coast. Good morning, Esther.
Good morning.
Okay, so what's up? What's your question?
Okay, I'm a newborn mother. I just gave birth a baby boy last week. And then my baby finds it very difficult to suck my breast. I don't know if it's because of my nipple. Anytime he wants to suck the breast, he puts the tongue just close to the nipple, which sucking becomes very difficult. I just learned that we shouldn't breastfeed them with a feeding bottle. I used to pump the breast in the feeding bottle and then give it to him. But I have learned something today that we shouldn't do that. So I want to know how to help him suck the breast well, because he can't put the nipple in his mouth.
Okay.
Anytime he puts the nipple in his mouth, then he brings his tongue close to the nipple.
Oh, you sound so frustrated. I'm so sorry. I'm so sorry. I hope we can get some answers for you this morning. Let's talk to Angela from Kumasi and then we'll take some answers. Angela, good morning. What's your question?
Good morning. Please, I have a 1-month-old baby and I'm not getting enough breast milk. So I want my midwife to at least educate me. I'm almost done my maternity leave.
Okay. So, how do you know you're not getting enough breast milk? When you say you're not getting enough breast milk,
like when I express, I get at least the maximum is 120 ml.
Okay. Okay, sure. Okay, so let's take the question. So the first one was the complementary feeding and the fact that the child is not eating other stuff. So how do you deal with that?
Okay. So when you introduce the complementary feed, it's a new thing for the baby. So you have to take your time. You introduce, let's say if you are introducing Tom Brown, you make sure you do the Tom Brown for maybe 3 days so that you know if the baby likes the Tom Brown or if the baby is having any allergies. Then if you notice baby doesn't like it, you can change to another meal.
Okay.
But once we are feeding the baby, when you take some, baby knows that, oh, okay, mother is eating some, the baby will eat it. And some babies will prefer you putting the food there, then they will be taking it.
Yeah.
Yes, and you have to feed the baby with colorful things. You know, baby like colorful things. So you make sure that things that you are feeding with the baby, they are colorful. You can change bowls, spoons, sink for the baby. If you are doing all these things and still baby is still not taking the food, you bring the baby to us. We take to the nutritionist, then we know how to go.
Figure it out. Okay. Do you want to add something?
Let me chip in with what she said. So with the complementary feeds, the advice is that you start with the feed first, so that because he's saying that the baby takes breast milk more than the other feeds, so he should start with the
other food first. Okay.
And then we'll supplement with the breast milk.
Yeah.
So that baby is hungry, quickly give the baby either the cereal, the cocoa, or the Tom Brown. Then later you can give the breast milk.
The breast milk, yeah.
Yes,
because if you give the breast milk first.
Definitely baby is not going
so
to
the complementary feed first, then we follow with the breast milk.
Yeah. And let's remember that we're introducing a whole new world of food. So it requires a lot of coaxing and, you know, singing and airplanes flying. It's a project. So, you know, stick with it. I think if you stick with it, we'll get there. And the second question that came was about the fact that the baby wasn't latching on. So she wanted to know if it was an issue of the latching technique or whether it was her nipples.
Okay. So we would have a demonstration, and that would have demonstration on how to latch. Which baby to breastfeed.
Okay, so let's do the last question, which was, and I'm trying to remember, was about not enough milk. Okay, so she said she was getting a maximum of 120 ml. And so was wondering how to make her body or encourage her body to produce more milk.
So with that, the more baby breastfeed, that's when the milk is produced. So if baby is not latching well, there's no way the breast milk will flow.
Okay.
If mother is stressful, there's no way the breast milk will flow. So it's two things. It's either the technique is wrong,
or you're stressed.
Or you're stressed.
Okay. And she did sound a little stressed.
And also, let me chip in. Sometimes we have what we call the feeding cues. Feeding cues basically means the things that will let you know that the baby wants to feed. For example is baby would open the mouth, baby drawing closer to the breast. If you ignore all that, you get to the late cue. Baby will be agitated, will not be able to take the breast. Okay. So we should take it. We should note that we should ensure that babies are able to breastfeed well, and the mothers shouldn't ignore the feeding cues. Yeah. She's tired and sleeping, and sometimes what we realize is that the baby cot is in the other room and the mother is in another room. So getting up to even breastfeed becomes a challenge. But the baby cot should be close to you so that quickly you could see the signs and then you would put baby to breast. If you wait, baby will be agitated. Unfortunately, you give the formula and then you think the baby has taken enough.
Okay.
So
what we'll do in our demonstration, and also to deal with the stress of breastfeeding, is show our mums how to relax and enjoy the feeding process so that your body is in optimal state so that you can produce enough milk for the baby. We have Joe calling us from Takrade. The men are very interested this morning. Good morning, Joe.
Yeah, good morning.
Hi. Okay, so what's your question?
I'm watching your program.
Okay, so what's your question?
Good morning, madam.
Okay, I think I have both Joe and Joseph on the line. Interesting. Okay, hello, Joseph. You're calling us from Accra.
Yeah,
right?
I've heard. I have one month, 3 weeks, but the breastfeeding wasn't enough for her. Is it advisable for us to add the milk, like one or that 10 milk, for her to get enough milk? Because I think most of the time when you go to hospital, that weight, what the nurse wants is the baby have increase of weight. So if the breastfeeding is not enough for her, is it advisable for us to add other things to it for her to get the weight?
Okay, how old did you say your baby was?
1 month, 3 weeks.
1 month, 3 weeks. That's about 7 weeks.
So I want to know whether because what I've seen is the breastfeeding is not enough for her. When you give it to her just now, maybe about 2 minutes, 3 minutes, she'll be crying. I think always she wants more, and the mother can't give it to her always. Putting it into his mouth for her to be there just like that. When you leave it, then she's crying. She needs more. And the breastfeeding is coming. The breast is coming all right. The milk is coming all right.
Okay, I understand. I think patience, right? You have to sit down and
yes, it's patience. And from what he was saying, he said the breast milk it's flowing all right. It could be that the technique is wrong. That is one. It could also be that some mothers, when they put the baby, when they are breastfeeding, and 5 minutes, they stop.
Yeah.
Baby, it's fine. But then when you breastfeed the baby well,
and they are
full, baby will sleep for 2 to 3 hours. When baby, you can change 5 wet diapers, baby will pass too well. So it's not about adding the formula.
It's about taking your time.
It's about taking your time. And it's about the position
and attachment.
And the attachments.
Yes, position and attachment will help with breastfeeding.
Okay, so let's talk to Amadou, and then we come and do the demonstration of the positioning and the attachment. So Amadou, I'm calling us from Obuasi. Good morning.
Yeah, good morning.
Hi. Okay, what's up? What's your question? Okay, I think I've lost Amadou, but I have Joe in Takrade. Joe.
Hello, I'm still around.
Okay, it's Joe that I lost. Amadou, what's up? What's your question?
Yeah, I want to know how many months will the baby start to feed the normal cocoa porridge that we have? Let's see, before the breastfeeding.
Okay, so he wants to know when to start.
And then the second issue is that right now my baby, like whenever he starts to take the breast milk, the mother always get feeling pains in the breast, pains all the time. And then always, I don't know. So sometimes it normally takes small, then wait small. I don't know what we can go for the formula feed for the baby.
Okay.
Let's say the number 1 or the SMA gold, which of them will be appropriate. Because always when it starts, the mother starts feeling pains. And then sometimes usually guys have.
Oh, okay. Sorry about that. Sorry about that. It's tough. It's a difficult phase. But let's talk about the first question was when to introduce cocoa and stuff. That would be after 6.
After 6 months, and we are saying that we have to ensure you give varieties. So as my other colleague said, if you are given cocoa between 3 days to a week, you try and see the baby will tolerate. Some of the babies are allergic to some of the food that we give them. So take your time, have patience. The baby will take a little, will stop gradually before you introduce another one. And then ensure that you give the feed before you breastfeed.
Yeah.
If the baby is full, baby will not take the breast milk.
Okay.
So let's give the complementary feeds and then we'll add with it.
Okay, then let's talk about pain. So there's the engorgement, there's the painful nipples, there's all of those things.
Yeah. So when the position is not done well, when position and attachment is not done well, that is when we have the engorgement of breast, sore nipple, and other issues. So it's about the position. Sometimes the mothers, okay, we are going to talk on that.
Okay, no, so go ahead and let's do the demonstration.
So, the mother should always be in a comfortable position. If she's sitting in a chair, there should be a back support like this. The reason is that when she's breastfeeding, the chance of her burning is very high. And that will cause her pain and will feel reluctant to continually breastfeed her baby. So get a chair with a back support. If you want to sit in bed, make sure you lay on the wall. Some people prefer sitting on the floor, but make sure there's a back support for you to be in a sitting up position.
Okay.
So she'll be in a sitting up position this way. And then her baby will lie in between the baby's body will be close to her body.
Let's remove it so that they have a look at it.
The baby's head and body should be in a straight line. Can you all see?
Yes.
Good. And then her body, the baby's body will touch the mother's body or abdomen. And the mother will hold the baby close to her abdomen, and then the full baby or the full body will be supported with another arm.
Okay.
Like this. So the chair is okay, she's relaxed this way. And then, please note, 4 fingers beneath. So the chest, beneath the breast. So close to the chest wall, beneath the breast. So gives you the shape of the breast. And then the thumb on the breast. Close, it shouldn't be close to the nipple. Let's avoid the scissor hold. The index finger and then the middle finger. Some mothers do this.
Yeah.
The scissor hold. Let's avoid that. The reason is that when you do this, you block the duct. That is where the milk is stored. So if you have blocked the duct, you might think baby is sucking. Unfortunately, baby is not sucking. So we've gotten our position. Now we are coming to the attachment. So the attachment, first of all, the baby's mouth is widely open. The baby's mouth is widely open. And then also, the baby's lower chin is attached to the mother's breast. Baby's mouth is widely open. Then the baby's chin is attached to the mother's breast. Sorry, the lower chin is attached to the mother's breast. And then there is more areola. Note, there is more areola. The areola is the black spot. The baby's, the mother's areola should be more areola above than below.
Okay.
So they ensure that the baby is not sucking the nipple, but the baby should be able to take the black spot. That is where the milk is stored. So maybe the first caller was saying that when the baby sucks and then unfortunately the baby is not satisfied. It's possible that the mother is not getting the attachment right. The baby is sucking the nipple. the baby suck the nipple, we have what we call sore nipple and then engorgement of the breast. She'll have pain because of what? The continuous sucking of the nipple. There'll be break in the skin. So unfortunately, baby would what? Mother will have pain whilst breastfeeding, and then she won't be able to what? Continually breastfeed her baby. So more areola above than below. Baby's mouth is widely open, and then the baby's chin is also touching the mother's breast. We are good to go.
So wait, just to clarify, are we still putting the nipple in the mouth?
So we are saying that the baby would be able to suck gradually because of they're able to get the sense of the breast milk. So the baby will latch to the breast. You don't give the breast to the baby, but rather you give baby to the breast.
Okay, so you don't just want the nipple.
The nipple
in. The areola, the
black whole.
Yes. More areola above than below.
Okay.
Yes.
All right. I think we get that. And of course, you don't want to have your hand completely hurting, so you can put a pillow here so that the baby is supported.
And we have different types of breastfeeding as well. We have what we call the underarm. So with the underarm, a pillow will be supported this way, and then the baby. So, okay.
Okay, so there's this as well. Okay.
This as well. This is what we call the cross cuddle. Cross cuddle. Cross cuddle. And then the underarm to like this.
Is the other way around.
So this way.
Right? Yeah.
So the pillow
is this way.
And we are good to go. You put your hand this way to support the baby's neck in. It is safe.
Okay.
So there are various positions for you to.
Okay. I think what's important is that find what is comfortable for you and for your baby. Have patience. It doesn't come as easy as we would like. And remember that it is a sacrifice ultimately. Your body's gone through a lot to produce this human being. And so give yourself some time to relax and do it comfortably. So find a comfortable chair or a bed and relax, and let's just know that it's an experience. It's National Breastfeeding Week, so we will return to this conversation. We'd love to have more of your questions. You can follow us on social media and post your questions there, and then we'll have our experts come and answer for you. But we hope we've helped you this morning. And if you're a mom and you're breastfeeding, we're with you. We're supporting you in spirit. Keep at it. It will get better, and you are giving your child the best possible start that you could.